Assalamualaikum. So today my group and I will present about cardiac hypertrophy. What is cardiac hypertrophy? Cardiac hypertrophy can be defined as an abnormal increase in muscle mass, which is in our heart at the left ventricle. Hypertrophy in cardiac is also known as ventricular remodeling. Hypertrophy in cardiac is associated with alterations in cardiac geometry, which is in size and shape. Other than that, hypertrophy can be simply considered as cardiac hypertrophy, and that is not pathological because cardiac hypertrophy initiated to follow physiological hypertrophy. Physiological hypertrophy is initiated by anatomical tissue rearrangement and optimizing its function. Okay. Other than that, endurance training, one of the cardiac endurance or cardiac adaptation that is favorable, and it is include increased cardiac mass, cardiac output, and more.
My name is NURIN AMELDA AMANI. Now the topic that I will tell you guys about an incident among athletes. In this topic, it is tell about which the group of athletes always get this advantage. Actually, it is almost the same as the example of sport that lead to cardiac hypertrophy. But incident is more to which athlete always gain cardiac hypertrophy. So we have three examples here, which is rowing athlete, swimming athletes, and cycling athletes. There are most many type of sport that consist of endurance athlete, but we choose a sport that put high pressure on the body and heart of athlete, which is involve the strength and endurance. Next is the example of sport that lead to cardiac hypertrophy, which is long distance running, cycling, orienteering, and triathlon. Next up is ADRIANA BALQIS, who will tell about the advantage and benefits of cardiac hypertrophy. And thank you.
My name is ADRIANA BALQIS binti Syed. So I will continuing with presenting about advantages of cardiac hypertrophy. Cardiac hypertrophy can increase stroke volume, where stroke volume is the amount of blood released through a single heartbeat or one stroke. Stroke volume is associated with cardiac hypertrophy as the ventricular cavity increase, so the amount of blood pumped into it also increases. So next, cardiac hypertrophy also increase blood vessel density, where blood vessel density means the number of blood vessels contained in a muscle fiber, and the activity that is carried out causes the blood flow to the muscle tissue to increase. This causes the opening of passive blood vessel and also causes the use of existing blood vessel to be more active. Next, cardiac hypertrophy will decrease resting heart rate, where resting heart rate is one of the indicators of a person's fitness level. A low resting heart rate will describe a person as a fitter than a person with a high resting heart rate. And lastly, cardiac hypertrophy will help normalize ejection performance, where cardiac hypertrophy provides mechanical advantage that help normalize ejection performance in the face of increased workload. So next we go to the conclusion. Cardiac hypertrophy can be increased with endurance training and also can give positive effect to the heart. So, different pattern of exercise hypertrophy reflects difference in ratio ventricular internal wall thickness. That's all from us. Thank you.